assisting with the progression of Avery's ALS. ALS is a neurological disease that attacks the brain, telling it to shut down different parts of the bodies, eventually stopping the heart.
I'm Nurse Spencer. I am a respiratory nurse. And basically when Avery Hall, when she progresses further in the stages of ALS, I will try to assist with her breathing. She was diagnosed a year and a half ago.
My name is Avery Hall. I'm 25 years old. And I suffer from a condition called ALS.
During the progression of this disease, different parts of the body will be shut down due to the disease attacking the brain and telling the brain to shut these places in the bodies down.
Living with ALS has been a challenge ever since I got diagnosed. I can feel my body rapidly deteriorating and I need more and more assistance with daily activities. Every day I think of my life 20 years ago when I was full of energy.
Usually with ALS, patients die of suffocation because they can't breathe or their heart just stops.
Hello, I'm PharmD James Alice. ALS cannot be cured and it has a 100% mortality rate. The only way to help is to extend our life as much as we can. And I'm creating a medicine to help slow down Avery's ALS. Here are Avery's medications.
Thank you. Me and Dr. Christopher will administer these to Avery.
Making the medicines isn't hard, but knowing that I can't save their lives are.
Hello, I am Lopez De Paz and I am Avery Hall's pathologist. I'm going to figure out what caused Avery's condition.
This is my first patient with ALS, and I really want to just touch up on this because I want to make sure she lives the fullest she can.
As a pathologist, my role is to identify the cellular markers of ALS. Though the primary cause of the disease remains unknown. Under the microscope, we observe a combination of genetic mutations and internal failures, including protein clamping and mitochondrial decay. These disturbances trigger more neuron death and heavily inflammatory response from surrounding immune cells. Because we are navigating a landscape that is not yet fully understood, we rely on these visible patterns of cell death to provide diagnostic evidence needed for clinical care.
Even with all the knowledge, we're still not advancing in. The hardest part isn't retaining information, but using it.
After I finish making Avery's synthetic voice, we will test it out and just make sure that it sounds okay.
Well, when it comes to being a doctor, we see death every day. But when it comes to dealing with patients that I know have terminal illnesses, it is hard on me, to tell a patient that they're going to die and this is possibly how it's going to happen. So Avery, as you know, ALS is a terminal and incurable disease. So the best we can do for you right now is prolong your life, but yeah, death is inevitable. Sorry.
Do you want anybody to talk to about this?
Yes.
Okay, I can get Dr. Christopher to refer you to a psychiatrist.
Okay.
Thank you. I will get back to you guys quickly.
I am Dr. Tipton, and I am a psychiatrist that is here to help Avery with her ALS. As her psychiatrist, I'm going to help her mentally, whereas the other physicians will take care of her body. ALS can be a very traumatic event in someone's life since it's a guaranteed death sentence. So I am here to make sure Avery can live the rest of that life as calmly as she can. Hello, Dr. Christopher.
Hello, Dr. Simpson.
So
This is for Avery. She's a patient with ALS and she needs a psychiatrist.
Okay, thank you. I'll get to work with her and help her mental state. Being a psychiatrist does have its issues, and there's a level of professionalism that needs to be held between the patient and the doctor. So how are you feeling today, Avery? That makes sense. But sometimes it's good to show them you're human too, and that you're here to help. So how do you feel about learning about your illness?
I just can't stop thinking about dying.
Avery, that sounds really rough.
Thank you. Now to give these to Miss Hall.
Being a nurse is extremely rigorous, but it's my passion, and I love to help people. Oh my God. Creep.
It's sad to know she's gone, but we did everything we could.
I'm always gonna miss her and remember her.
I will forever always be grateful for her being my first ALS patient. I'm gonna miss her.
Avery was a good patient. She was a strong person, and it's very sad that people in general have an illness like this, that this illness even exists. But Avery, she didn't let ALS control her, even when it was actively killing her, and it's something that I